I'm Dr.Supreeth, a physician, a consultant physician in Mahaveer Jain Hospital in the Department of Internal Medicine. I've been working here for past 12 years in the Department of Medicine.
Excellent. Thank you so much for taking the time and joining us today. And Doctor, as we discussed earlier, the entire idea of today's conversation is about trying to break the myth around people going to hospitals, especially senior citizens. They feel very vulnerable. They feel very sometimes cheated when they go to the hospital. And they quite often feel confident in asking the right things. What are their rights? So I thought we will use this podcast with you as a reputed general physician to help some of those questions that we received from seniors. So I think the first question I would ask you is, for a senior citizen who's over 60 plus, are there certain sets of tests that you would recommend that they should do on an ongoing basis that would help them?
See, again, depends on what diseases they have. If she has, most common in India is they suffer from diabetes.
Mm-hmm.
So they need to check it up at least once in 3 to 4 months, a fasting blood sugar,
Okay.
and an average HbA1c, or glycosylated hemoglobin,
Right.
a blood pressure checkup.
Mm-hmm.
Okay, maybe once a year creatinine, an eye checkup.
Mm-hmm.
All those things are very, very important. And
Right.
lipid profile,
Lipid profile.
yeah, once a year is a
Once a
must. Yes.
Understood. And for a lot of people, when they go in for their basic tests, the issue that they face is that they're suddenly inundated with 100 other things that they should do. What would you recommend for seniors when they are getting, posed a bunch of tests they should do? What can they do to get comfortable whether or not those tests are okay for them to do? Do they have the right to ask questions to the doctor?
100% all the patients have right to ask questions, first thing. But what happens is most of the people, what they do is they go to the lab,
Yeah.
they say master health checkup,
Mm-hmm.
they do the tests which are not required for them and miss out on the important things. So I would say first go to a physician, find out what is the health problem, what relevant test needs to be done, and then correlate. It's not all about we don't treat the lab, we
Mhm.
treat the patient.
Right.
First, what patient symptoms are there,
Right.
then we follow it up with the reports and correlate, and then finally give a treatment. But it has become the other way, where patient just go to the health checkup, do some test
Right.
and all those things, and then we end up treating the lab than the patient because
Rather
we
than
don't
the
know.
patient.
Yes.
Absolutely. So I think there are two parts to it. One is that you're saying that there are certain sets of tests as you get older you should do because it gives you a good check. But should you have any symptoms, this is an interesting point that you mentioned, come to a good general physician, which
Yes.
doesn't quite often seem to be the case in India. People tend to go with recommendations from family, friends, from Google,
Yes.
more often than actually going to general physician. Can you just maybe elaborate a little bit more on what is the role of a general physician? Why that's important?
Because as a physician, he does not seem to only, because if you go to cardiology, his specialty is only cardiology. He does not bother. Means he's not concerned
He's not
about
aware,
diabetes
or-
or this one. So he will only treat the heart and hypertension. Then they need to go to a diabetes specialist to treat the sugars.
Right.
If they have hypothyroidism, suppose they have asthma, then they need to go to a pulmonologist. It becomes a huge mess, and they don't know what medication needs to be taken and all. So general physician will help you in that. He channelizes what needs to be done, what medication needs to be done, and whom to refer, what test needs to be done. So he can channelize the test, he can channelize the treatment,
Mhm.
and so that the patient is in the good hands.
Excellent. And it's a similar concept they have in the UK as well as in the US, where you have a general physician you typically go to. India is starting to make a comeback of these family physicians, which are the same as what you mentioned as general physicians. Are you seeing more and more adoption of that across families that you're dealing with?
Family
Not so much.
physician, not so much, madam, because they are in every field. They know gynecology, they know everything. But difficult. I feel a general physician can do much better. Maybe who does in studies in internal medicine.
Right.
Most of the time, he or she will be a better person than the family physician. It's my personal
Understood.
opinion.
No, that makes sense. That makes sense. And what are the best ways do you think that people can proactively take care of their health once you're a senior citizen? What are a few suggestions you would recommend they do?
The important thing is to keep them a diet.
Diet.
Healthy diet is much more, for any diseases, healthy diet is a must, and keep themselves active. Most of the time, they 60 above 61, lack of energy, lack of motivation,
Right.
those things. So they need some space to walk around.
Right.
So they need a group of people to walk around,
With
a good
Mhm.
space.
Yeah.
That is very, very important, and keeping themselves healthy, there is no second thoughts about it.
Right.
Keeping themselves healthy, because our aging population is going to increase by next 20-30 years. There
Yeah.
will be more people above more than 50, 60.
Yeah.
So we need to have a good education for them how to take care of it. And no second substitution for diet and exercise.
Diet and exercise. So
Yes.
we've heard it straight from the mouth of the doctor. Diet and exercise is what will keep you healthy
Yes.
and live long.
Yes.
Excellent. I'm just going to see if I want to ask another question. We can edit it. Yeah. Important tests you talked about. Okay. You mentioned in terms of deterioration, so symptoms. Are there certain signs that one should be very wary of as your seniors to immediately or promptly go to a doctor? Are there certain symptoms that you would suggest people be very aware of?
Very important thing is very important. One, any numbness.
Numbness.
If you think in terms of stroke because of the diabetes, hypertension,
Yes.
numbness or weakness or any giddiness, consistent giddiness, vomiting, difficulty to walk
Okay.
alone. First thing. Second thing, chest pain,
Chest
breathing
pain.
difficulty. Say if an elderly above 60, they are able to walk 3-4 kilometers every day,
Yeah.
and suddenly in 2 days they need to take a break for 5 minutes or 2 minutes, profuse sweating.
Okay.
Those
Profuse
things
sweat.
indicates there might be a myocardial infarction. Those things.
Okay.
Or if there are another thing is elders, they usually don't manifest with fevers.
Right.
They usually have the decreased appetite. That means they're eating well. Suddenly in 2-3 days,
Drop.
they drop in their appetites. So that is an indication that there might be an infection which we need to be addressed.
Understood. That's really helpful. So basically, shortness of breath, anything to change in terms of your pace that you've been able to do, sudden slowdown, profuse sweating, numbness, any sort of numbness,
Weakness.
and sudden drop in appetite. Those are good symptoms to keep an eye on. Should those happen, call your physician.
Yes.
Perfect. That's all I had for you, doctor.